to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our weekly list of 5 things you should know about. Coming in at number 5 this week, news that is very important to lovers of Oreo cookies everywhere. Oreo recently announced the comeback of an old favorite. The golden birthday cake flavor is back from its 12-year hiatus. The golden birthday cake flavor features the golden or vanilla version Oreo cookie with rainbow birthday cake flavored cream filling inside. It is hands down my favorite flavor of Oreo, and I was so sad when they discontinued it. It'll be back on shelves March 3rd, just in time for my birthday, so a pack of those will definitely be on my birthday list this year. Sadly, this cookie is still going to be a limited edition flavor, but here's hoping that it'll become a regular spring release rather than a once every 12 years release. Also new from Oreo, a double chocolate Cakesters Oreo. That flavor will be a permanent addition to the Oreo Cakesters lineup and will be available beginning February 24th, so be on the lookout for both of those. Number 4. Super quick mention here, but an important update for Kindle readers using this feature. Beginning on Wednesday, February 26th, the Amazon Kindle's download and transfer via USB function will be discontinued. If your current process involves downloading a Kindle book to your computer and then using a USB to manually upload a copy to your Kindle, transfer a copy to a non-Amazon branded e-reader, or maybe you just like having an archive of your digital purchases, this change will affect you. For readers who use non-Kindle e-readers, if your particular brand of e-reader is compatible with the Kindle app, you should still be able to download and read titles with Wi-Fi access. Prior to purchasing my Kindle, I downloaded the app on my iPhone, and I did purchase a few books that way. But if you've been meaning to download backup copies of your ebooks for archive's sake, that is a project you will want to take on sooner rather than later. Also, a good reminder that digital property isn't really our property, even though we have purchased it. We've experienced that in the past with digital copies of movies. Now it looks like we're facing the same arguments with ebooks. Now, here on the podcast, we've talked about borrowing ebooks from libraries through the Libby app. That can be a great solution when you don't want the physical copy of a book gathering dust in your home, or you live on a budget and don't have the funds to read everything on your TBR list without serious financial crisis. For more on the Libby app and on this new update from Amazon, be sure to visit our episode notes for additional resources. Coming in at number 3 this week, news you probably have already heard about, but we want to make sure we mention it here for obvious reasons. On Thursday, last week, Robert F. Kennedy Jr. was confirmed in a 52-48 Senate vote, naming him the 26th Secretary of the Department of Health and Human Services. In other confirmation news, Dr. Mehmet Oz, President Trump's pick to head up the Centers for Medicare and Medicaid Services, has just begun meeting with senators ahead of his confirmation vote, but the date for that hearing has not yet been set. We'll be keeping an eye on those and other healthcare-related cabinet hearings, so stay tuned. Number 2, despite the current lack of a CMS administrator, the Trump administration made their first announcement, a cut in federal funding to the ACA Navigator program beginning in plan year 2026. Back in August 2024, the Biden-Harris administration allocated up to $500 million to the Navigator program to be distributed over the course of 5 years. We are currently in the 2025 plan year, so $100 million has already been allocated to the Navigator program. For plan year 2026 through 2029, the Trump administration is cutting funding to the ACA Navigator program to $10 million per year. According to CMS, the $360 million savings, quote, will allow the federally facilitated exchanges to focus on more effective strategies that improve exchange outcomes and to reduce the user fee in future years, which would translate into a reduction in premium, end quote. CMS provided a breakdown in cost per enrollment based on the money awarded to Navigator grantee organizations. For plan year 2024, that cost came in at an average of $1,061 per enrollment. When looking back at comparable data prior to the COVID-19 pandemic in the 2019 plan year, quote, grant funding level reflects a far more efficient $211 per enrollment, end quote. We'll be linking to the CMS press release in our notes, as well as a write-up from KFF that includes, as always, a helpful graph that breaks down funding by state. And now coming in at number 1 this week. Last Thursday, while drinking my morning tea, I came across an article about baby boomers and their generation's potential impact on nursing home populations. The first cohorts of the baby boomer generation began retiring in 2011. We've all been hearing about the record number of individuals aging into Medicare by 2030. And we are well into that time span with just 5 years left to go. As the baby boomer generation has continued to age, we're getting into a new phase of their retirement, the potential need for care somewhere other than home. While some seniors are able to afford the cost of care as they age in place, that is not true for everyone. SeniorLiving.org recently made projections based on numbers from the Center for Disease Control's Wonder database, running those numbers by KFF data on certified nursing facilities and the number of beds in those facilities. According to their estimates, the country could use quite a few new facilities to keep up with the burden of care. Quote, the nation could need as many as 3,000 new nursing facilities to keep pace with the surge in population among older adults, end quote. Their snapshot takes a look at a few different factors: the projected change in the 65-plus population, how many new nursing homes would be needed to keep up with that growth, or the number of additional beds needed per facility if no new facilities are built. Each of those estimates is broken down by state, which I always appreciate, so you can get the current numbers from your area. Keep in mind, population growth is an estimate, but as far as the KFF data on certified nursing facilities and the number of beds per facility, that is based on data current to 2024. Here in Pennsylvania, the state both the Agent Survival Guide podcast and Ritter Insurance Marketing call home, we are looking at a 15% growth in the 65-plus population by 2030. According to KFF data, we would need either 101 new certified nursing facilities to handle that much population growth, or all of the existing nursing facilities would need to add an average of 19 new beds to handle the influx of patients. Currently, there are 670 nursing facilities in Pennsylvania, and here we average about 126 beds per facility. Let's take another state. We'll say Texas, because that is where Integrity headquarters is located. In Texas, the 65-plus population is projected to increase even more, by 28% by 2030. Texas would need 340 more nursing facilities to keep up with those projections, or they would need to add 31 beds to the existing facilities. And when we look at 2024 numbers in Texas, they've got 1,184 facilities with an average of about 113 beds per facility. Now, I do not highlight these numbers to scare you or your clients, but if you're offering short-term care and long-term care policies, you should be aware of the numbers in your state. These are great stats to add to your presentations so that as you and your clients are looking at retirement planning, They know what's available to them, as well as the other options they may have or the options that you can help them plan for. Again, we'll be linking to those resources in the notes, so be sure to check them out for more information on the projected demand for nursing homes, as well as everything else we mentioned here today. And with that, we are at the end of another Friday 5 episode. Thanks so much for listening. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week.
The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with us wherever you like to listen.